Hello, this is Dr. Patrick Hu from Moffitt Cancer Center, and we're here in Chicago, Illinois at the annual ASCO meeting. Today I'm here with Dr. Michael Vogelbaum, neurosurgeon from Moffitt Cancer Center. We're going to talk about brain tumors. Thanks for coming by.
Oh, it's a pleasure. Great to see you here in Chicago.
Yeah, it's great. So tell me, what's going on with brain tumors? It's a challenging tumor to treat, glioblastoma, right?
Right.
Any progress here at ASCO?
So, I wish I could be more positive and say there's been a great breakthrough, but unfortunately, we're still struggling to try to find treatments that are actually effective for this devastating cancer. So there is progress in terms of new trials, new results, but they come back to some of the same themes we've had in the field, which is difficulty getting therapeutics into the brain, to the site of tumor, and difficulty overcoming the immunosuppressive environment of brain tumors.
So tell me about what you think the answer to these great challenges in treating glioblastoma will be, and what are you and the team doing at Moffitt Cancer Center for this?
Well, great. So one of the major challenges with immunotherapy, for example, is the immunosuppressive environment of glioblastoma. And of course, we have a great team at Moffitt that is studying elements of the tumor microenvironment with our immunobiology group in particular. So we are continuing to do that work. I have a grant where we've been focusing on myeloid-derived suppressor cells, their role in mediating that immunosuppression. There are other myeloid elements as well. We're collaborating with Filippo Veglia, a new member of the immunology group, who's looking at tumor-associated macrophages. So that's one approach, and then designing trials to try to suppress the immunosuppressive elements within the tumor microenvironment. And the other approach is delivering therapies directly into the brain. And that's something that I've been working on for a long time, developing new technology to try to deliver therapeutics more effectively to the brain, and then partnering with others who are developing therapeutics that we can introduce directly in the brain. And we have some trials going on now at Moffitt that relate to this approach.
Yeah, it's great. And we are working together on a Tcell project where hopefully one day you'll be delivering that directly to the brain.
I certainly hope so. I'm really looking forward to that.
And you're making some really cool devices also to deliver drugs to the brain directly, right?
Right. And then it's also changing the way we do our clinical trials in Neuro Oncology. We are adapting the phase 0 concept into our environment, which is slightly different. And we call these window of opportunity trials. Getting to brain tumors is not quite as simple as getting to a lymph node. So for us to understand what's going on from a pharmacokinetic and pharmacodynamic standpoint, we need to do a major operation. But we can set up our trials to take advantage of the fact that we do these operations all the time. And so we can give pre-surgical dosing of a new therapeutic and look in the tumor and see what's going on. And we've been doing a number of those kinds of trials at Moffitt as well.
All right, thank you, Michael. Dr. Michael Vogelbaum, neurosurgeon and glioblastoma investigator from Moffitt Cancer Center.